costs, steps that create more value for Americans, these steps don't pay off because our healthcare policies are generally not focused on supporting the best care at the lowest cost. They're focused on something else, and usually it's more volume and more intensity of services, regardless of their quality or their impact on patient health. And in that kind of a financing environment, in that kind of a regulatory environment, the real reforms in healthcare that we need don't come very easily. I had an example of this soon after I went into government in this administration, was still working over at the White House, and I heard from a group of surgeons, thoracic surgeons, who had what sounded to me like, when I talked to them, a very good idea. What they wanted to do was coordinate the care that they were providing for bypass surgery and other elective heart surgeries in a new way. They wanted to have teams of doctors, of surgeons working with nurses and anesthesiologists together that would have standard operating procedures. They wanted to use electronic records to do handoffs to the post-acute care team. You know, after you get discharged from the hospital, there's a lot of recovery time after major surgery, like heart surgery, to get you back on your feet, and a lot of things can go wrong in that recovery time as well. They wanted to implement steps that they had shown could reduce infections and so forth, and they had piloted these programs in a few hospitals, mainly in Virginia. And what they had found was that when they took all of these steps, several things happened. One, patients got better outcomes. They had lower complication rates, shorter length of stay. They had better functional outcomes as well. Two, cost of the Medicare program went down. The problem was that they had to make some investments in things like coordinating the care teams and investing in electronic medical records and communicating effectively with the post-acute care providers that cost money. But under the Medicare reimbursement system, where you get paid more when you have more hospitalizations and more imaging and longer rehab stays, they lost money when the hospital and the physicians lost money when they took these kinds of steps. They had what seemed like a pretty simple idea. They wanted to get paid in a different way, where if they documented that they were actually improving quality and lowering overall cost of Medicare, all they wanted to do was share in some of those savings. Well, it seemed like a nice idea to me. Unfortunately, when I talked to the lawyers, they told me it was illegal. The way that Medicare pays is based on volume and intensity. In fact, there are specific rules, the Stark and anti-kickback regulations, that prohibit any kinds of sharing of funds like that between the hospitals and the doctors, the other kinds of providers involved. Well, that's an indication that something needed to change. And over the last few years, there has been some very important progress towards getting to a healthcare financing system and getting to healthcare policy reforms that really support value, that really support steps like what those thoracic surgeons wanted to do to get to better care at a lower cost. And there's several key steps in doing this that I want to spend a little bit of time on. The first is measuring what we really want, not how many services a patient received, not how long, not simply how long they stayed in the hospital or how many costly complications they had,